Hello everyone, welcome to bonus material for Cosmetic Corner. And tonight we're joined by Iron Man, actually. For those of you who don't know, Dr. Ahmed also is Iron Man. And so he thought he would show up for our bonus material to talk about a couple things. So first of all, I'd like to know, what's it like being a plastic surgeon and a superhero? How do you do it?
You know, Chris, it's really difficult to achieve a work-life balance between running a busy practice and also saving the world and inventing new technology. It's very challenging.
Well, I have to say I'm super impressed. So, rhinoplasty by day, superhero by night, just simply amazing. So lastly, I just have to ask, you know, your nose is kind of flat, but you do have some prominent cheekbones. Have you had filler in your cheekbones there?
You know, Chris, I've had so much filler in my cheekbones that my nose disappeared.
Excellent. Well, Iron Man, thank you so much for joining us. Everyone, we hope you enjoyed this, and we'll see you next month. I think one final question for our viewers. You know, we live in a world where we're very evidence-based in how we look at research, and we're really trying to make sure that the scientific method and the research is solid. But in this case, here we have a very thought-provoking title, as you mentioned, on a topic that might be underreported in our literature, most likely is, but also can be very relevant as it's a devastating complication in our patients. And then we see an expert like Dr. DeLorenzi say, yes, the scientific method may have been weak, but clinically, I've certainly observed this. How do we, as surgeons and scientists, interpret this and process this information?
Yeah, Chris, I think what's important in this is that it is more knowledge to help us that we use consciously or subconsciously when performing injectables. As you know, as a good anatomist and someone who does a lot of these procedures, there are things that you consciously think of when you're injecting and also probably subconsciously think of based on your knowledge of the anatomy of the potential for complications. And it's interesting in this article that these patients were referred to the Center for Treatment, and in many instances, not immediately. You know, some of the patients were referred a few weeks later and had severe complications. I suspect that in a lot of cases, the complication occurs potentially even while the patient's receiving the treatment, and is not recognized, and probably not recognized because of a lack of knowledge. As you know, and you know, this study is out of Iran. There are a lot of providers performing injectables, many of whom don't have the appropriate knowledge or experience to do them, let alone recognize these severe complications.
No, you're absolutely right. And I think that the pearl on that as well is that Dr. DeLorenzi mentioned that hyaluronidase may have been under-injected, otherwise it was under-treated, and really taking home the point of the pulse dose approach and really making sure you flood that area. So I really enjoyed visiting with you. We appreciate you taking your time. Thank you again.
All right. Thanks, Chris.
All right, everyone. Thanks for joining us. We'll see you next month on Cosmetic Corner.